I'm Cathy Turner. I work at the Walton Muscular Dystrophy Research Centre at Newcastle University, and I am the project manager for a project called DMD-Care UK, which has been working for the last 4 or 5 years in partnership with Duchenne UK to improve and harmonise standards of care delivery for Duchenne muscular dystrophy across the whole of the UK through the North Star network of specialist centres. The project was established to effectively translate the international standards of care for Duchenne muscular dystrophy published in 2018 in the Lancet Neurology into a practical, implementable guideline for the different areas of care in the UK. Now that's been very successful. We're working with networks of experts in the UK, from respiratory care to physiotherapy care to psychosocial specialists, developing these standards of care in conjunction with endorsement from the relevant professional bodies, with patient input as well as clinician input. Now the next stage and the next challenge is to turn that into change more widely in clinics for patients receiving care in the UK. So what we've done is developed a programme and a proposal and a plan that we will launch in January 2025 to establish a series of educational and training modules online that will be accredited so people can achieve their CPD points, along with some in-person workshops to do the same thing, to make sure that the standards of care guidelines that we've agreed and created by consensus in DMD-Care UK are disseminated widely, and the people responsible for delivering that care, whether they're a cardiologist, a respiratory expert, a specialist nurse, somebody working in an A&E department, are aware of those clinical recommendations and are trained and educated to deliver them. Alongside that, my colleague Emma Heslop works also in Newcastle at the Walton Muscular Dystrophy Research Centre on the DMD Hub, which is a project that's very well established and is expanding clinical research, clinical trial capacity within the UK for Duchenne muscular dystrophy. It's upskilling sites, it's increasing capacity, and it's helping to educate centres on how to best deliver clinical trials in Duchenne. That project is joining with DMD-Care UK, and both those projects are in collaboration with a patient organisation in the UK called Duchenne UK. So those two projects are joining together to create this education programme that I just described, in order that training and education about how to deliver clinical trials is put together with how to deliver clinical care, so bringing care and research together in this education programme that is called DECRI, the Duchenne Education for Care and Research Initiative. So that's our acronym, DECRI. We are currently talking to industry working in the Duchenne space in order to achieve funding for this programme, to set it up from January 2025 as a proof of concept. It will be focused initially in the UK, but then beyond that into year 2 and 3, funding dependent. Once we've proved the concept, we want to extend that to countries outside the UK. So free at the point of delivery upon registration, but for healthcare providers across all aspects of Duchenne muscular dystrophy care, the multidisciplinary aspects, and also at different professional capacities, so tertiary care experts and primary care providers, associated allied healthcare professionals, and community healthcare providers as well.